To slow the spread for 30 days. Together we have the power to save countless lives. We're attacking the virus on every front with social distancing, economic support for our workers, rapid medical intervention, and very serious innovation, and banning dangerous foreign travel that threatens the health of our people. And we did that early, far earlier than anyone would have thought, and way ahead of anybody else. In this time of need, I know that every American will do their patriotic duty and help us to achieve a total victory. As governments and nations focus on the coronavirus, there's a growing threat that cartels, criminals, terrorists, and other malign actors will try to exploit the situation for their own gain, and we must not let that happen. We will never let that happen. Today, the United States is launching enhanced counter-narcotics operations in the Western Hemisphere to protect the American people from the deadly scourge of illegal narcotics. We must not let the drug cartels exploit the pandemic to threaten American lives. In cooperation with the 22 partner nations, U.S. Southern Command will increase surveillance, disruption, and seizures of drug shipments and provide additional support for eradication efforts, which are going on right now at a record pace. We're deploying additional Navy destroyers, combat ships, aircraft and helicopters, Coast Guard cutters, and Air Force surveillance aircraft, doubling our capabilities in the region. Very importantly, our forces are fully equipped with personnel, protective equipment, and we've taken additional safety measures to ensure our troops remain healthy. Secretary Mark Esper, Attorney General Bill Barr, National Security Advisor Robert O'Brien will provide more details. In addition, I'm going to have General Milley, who's done an incredible job in so many ways, say a few words, and also with us our Chief of Naval Operations, Admiral Gilday, who you know, I think you know, and Commandant of the Coast Guard, Admiral Schultz. So I'm going to ask Mark to start, and then we can go. And after that, we're going to take questions as it pertains to this, and then we'll go on to phase 2, which is the virus itself. Okay? Thank you. Please, Mark.
Well, thank you, Mr. President, and good afternoon, everyone. I appreciate the opportunity to be here today as we make this very important announcement. At a time when the nation and the Department of Defense are focused on protecting the American people from the spread of the coronavirus, we also remain vigilant to the many other threats our country faces. Today, at the President's direction, the Department of Defense, in close cooperation with our interagency partners, began enhanced counter-narcotics operations in the Eastern Pacific Ocean and the Caribbean Sea. This initiative is part of the administration's whole-of-government approach to combating the flow of illicit drugs into the United States and protecting the American people from their scourge. I want to thank all of our partners in this effort, to include the United States Coast Guard, the Department of Homeland Security, the Drug Enforcement Agency, the Department of Justice, and members of the intelligence community for their tremendous support and cooperation. To conduct these enhanced operations, the President has directed the deployment of additional ships, aircraft, and security forces to the United States Southern Command area of responsibility. Included in this force package are Navy destroyers and littoral combat ships, Coast Guard cutters, P-8 patrol aircraft, and elements of an Army Security Force Assistance Brigade. These additional forces will nearly double our capacity to conduct counter-narcotics operations in the region. Additionally, 22 partner nations have joined us in this fight, bringing with them a variety of intelligence and operations capabilities needed to defeat these criminal organizations. Last year alone, United States Southern Command's operations resulted in the seizure of over 280 metric tons of drugs, much of which was designated for shipment to America. While this was an incredible achievement, there is much more work to be done. Transnational criminal organizations continue to threaten our security by smuggling cocaine, fentanyl, methamphetamines, and other narcotics across our borders. These drug traffickers put our communities at risk and destroy lives. Every year, tens of thousands of Americans die from drug overdose, and thousands more suffer the harmful effects of addiction. Furthermore, corrupt actors like the illegitimate Maduro regime in Venezuela, rely on the profits derived from the sale of narcotics to maintain their oppressive hold on power. The Venezuelan people continue to suffer tremendously due to Maduro's criminal control over the country. Drug traffickers are seizing on this lawlessness by increasing their illicit activities. We must do more to prevent these drugs from arriving at our shores. These enhanced counter-narcotics operations that are now underway will further disrupt the flow of illicit drugs to America, deny our adversaries the financial resources they depend on, and build the capacity of our partner nations throughout the region. I want to thank President Trump for his leadership and support to this critical mission. This is a particularly important time for this operation to begin. As nations around the world shift their focus inward to deal with the coronavirus pandemic, many criminal organizations are attempting to capitalize on this crisis. The enhanced operations we are announcing today will keep the pressure on these criminal groups and protect the American people from the devastation caused by the flow of illegal drugs into our country. Mr. President, thank you for your leadership as we begin this important operation. While the men and women of the United States military work hard here at home to fight the coronavirus, we continue to take action around the world to defend our great country. Thank you, and I'd like to invite General Milley.
Thank you, Secretary, for those words, and thank you, Mr. President, for your leadership. And I want to publicly thank Admiral Craig Fowler, the commander of U.S. Southern Command out of Miami, for leading this operation, which is underway effective today, and also Admiral Gilday, the Chief of Naval Operations, Admiral Schultz, for their contributions to this from their services. There's thousands of sailors, Coast Guardsmen, soldiers, airmen, Marines involved in this operation. We came upon some intelligence some time ago that the drug cartels, as a result of COVID-19, were going to try to take advantage of the situation and try to infiltrate additional drugs into our country. As we know, there's 70,000 Americans die on an average annual basis to drugs. That's unacceptable. We're at war with COVID-19, we're at war with terrorists, and we are at war with the drug cartels as well. This is the United States military. You will not penetrate this country. You will not get past Jump Street. You're not going to come in here and kill additional Americans. And we will marshal whatever assets are required to prevent your entry into this country to kill Americans. So right now the Navy has marshaled additional Gray Hull ships from both PACOM and EUCOM and for the Naval Fleet at Norfolk. And they are set sail already, and they are in the Caribbean right now. In addition to that, there's 10 Coast Guard cutters, and there's Special Operations Forces and Security Force Assistance Brigades, along with Air Force reconnaissance aircraft. The bottom line is you're not going to get through. Now is not the time to try to penetrate the United States with illegal drugs to kill Americans. With the United States military, we will defend our country regardless of the cost. Thank you, Mr. President. Thank you, Secretary.
Thank you, Mr. President. Thanks for your decisive leadership as we confront this unprecedented challenge posed by coronavirus. And I'd like to thank you for your support for this important initiative, and thank all of the Secretary of Defense and all the services for taking on this important initiative. Obviously, during this crisis, we're all focused above all else on COVID-19. But at the same time, our law enforcement and national security work must go forward, protecting the American people from the full array of threats. For the Department of Justice, one of our highest priorities must remain destroying the Mexican cartels. Their trafficking is largely responsible for the deaths, as we all know now, of 70,000 Americans a year. And also, the costs of this don't count the destroyed families, the destroyed lives, the draining of our national treasure as state budgets are crushed by the burden that this narcotic trafficking causes. The President has made clear that we are in this fight against the cartels to win, and that we are not interested in half measures, and that the threat posed by the cartel is not just a law enforcement threat, but a national security threat as well. And in December, building on your success with the Mexican president in forging a cooperative relationship in the area of immigration, you asked me to go down and meet with the President Lopez Obrador and our Mexican counterparts to see if we could also establish a more comprehensive and coordinated effort with the Mexicans in confronting the cartels. And we've had some successful visits and discussions, and currently have an array of activities underway against the cartels. And we anticipate, along with the Mexicans, that these are going to bear fruit in the months ahead. But it quickly became clear that we can obtain the most immediate results, the best bang for the buck, where we increase the assets involved in interdiction on both the Pacific and Atlantic side of Mexico and the Central American countries. For years, the cartels have been using these sea routes to take the cocaine up from principally Colombia, now also out of Venezuela. And these sea routes on both coasts have become the primary means of bringing cocaine up to the United States. Because of the superb work done by the Defense Department and our intelligence community, we know exactly, most of the time, where these traffickers are at sea. But have been up till now, significantly limited in our ability to interdict because of the numbers of the assets we have deployed. Prior today, this limitation meant we could only intercept a fraction of the traffickers and the various boats that were detected. This will now double our capacity, and we are talking about hundreds of tons of cocaine we're now in a position to seize. So this is going to radically improve our interdiction efforts and put tremendous pressure, we think, on the cartels. And the effort that Southcom is undertaking is going to save lives by taking drugs off the street. Last week, I announced the unsealing of charges of narco-terrorism, drug trafficking, and other crimes against the former Maduro regime, 16 members of that regime, and their involvement in trafficking of 250 metric tons a year. A lot of that comes by sea, as I discussed at that time, but also because of the pressure we're applying by our sea interdiction, they are trying to establish an air route out of Venezuela up into Central America, which is one of the reasons we're trying to move firmly against that corrupt regime. This drug war has gone on for many decades, and at times in the past, we've had great success and great results, and at times we've taken our eye off the ball. Fortunately, not in this administration, and I'm grateful that you, Mr. President, have brought focus to this fight and the determination to use whatever tools are necessary to win the fight. The cartels have to be defeated, both for the people of this country and for the people of Mexico and Venezuela. So I'd like to thank you again, Mr. President, Secretary Esper, for providing the wherewithal required to help win this war against the cartels and others who seek to send illicit drugs into our country. And with that, I'd like to introduce Ambassador O'Brien.
Thank you, General. Thank you, Mr. President. Today's action is another example of the bold leadership of President Trump and his commitment to protecting the homeland against threats that seek to destabilize the United States and our Western Hemisphere. The uncontrolled flow of illegal drugs into the United States poisons our communities, fuels the dangerous epidemic of addiction, and threatens the safety and security of all Americans. The impressive U.S. Navy, Coast Guard, Army, Marine Corps, Air Force, and interagency operation will address a range of threats to our national security posed by narco-traffickers and narco-terrorists. It will reduce illicit financial support for drug trafficking that provides the corrupt Maduro regime in Venezuela and other bad actors with the funds necessary to conduct their malign activities. Under President Trump's leadership, we will continue to execute our maximum pressure policy to counter the Maduro regime's malign activities, including drug trafficking. And this operation will help to choke off the funds that go to that corrupt regime. Maduro, narco-terrorists, and criminals should make no mistake that even as we are working around the clock to fight the spread of coronavirus, we will continue to execute the President's counter-narcotic strategy. We are working on a number of important national security priorities as we face this public health crisis. The United States will continue to combat disinformation and fake news about this virus. We will work with the world's largest oil producers to address volatility in global oil markets. We will always protect our servicemen and servicewomen, around the world, including in Iraq and Afghanistan. I want the American people to know that President Trump and Vice President Pence and their administration are working tirelessly every day to protect the health and well-being of Americans and respond to the coronavirus. Our adversaries should take note, however, this president has a clear-eyed focus on America's national security interest. And let me be clear, it would be a mistake with terrible consequences for any adversary to attempt to do us harm during this health crisis or ever for that matter. Thank you very much. Thank you, Mr. President.
Okay. So do we have any questions on this? Because this group is going to go back to work. We're going to leave. John?
Question either for you, Mr. President, or Secretary Esper. What has changed that is allowing these assets to be deployed now, whereas General Barr said in the past they were not available?
Well, for a long time, we've had a lot of drugs coming into our country, and it's not that it's increased. We've probably got it down a little bit, but it's still a tremendous number. Families are being ruined, lives are being ruined. It's an incredible thing, especially as you're at this position. You would never believe it. I see things that nobody would believe. I see reports that nobody would believe. So I met with the group behind me, all of them, and we said, what do you think we can do? And they think they can interdict. They think that we can stop it before it gets to the shores. And they're coming from all over the place. And we have incredibly talented people. So I think I'm going to let Mark just give them a little bit of an answer to that. But we just want to see if we can stop a good percentage of the drugs coming into our country.
Sure thing. Thanks, Mr. President. So first of all, it's simply a matter of prioritization. The President's given us very clear guidance on what's important to him and protecting the American people. And as some of you know, I began a review months ago looking at all of our different geographic combatant commands and looking at where we can free up time, money, and resources to put into other endeavors. In this case, we had scrutinized our inventory fairly closely. The Chairman Milley did a great deal of work on this with Admiral Gilday, and we felt that there was no risk to the fleet, to our operations, to free up, in this case, naval ships. We also freed up aircraft and other assets to apply them to this presidential priority. And, of course, the Coast Guard did the same. So it was a very good operation. We feel this is very important to the American people and completely in line with the President's direction.
And how long will you be able to keep up this operational tempo?
Well, it depends. What we're going to do is we're going to run it for some matter of time. I'm not going to disclose how long that will be, and then we will assess it, and then we'll make adjustments from there. We may increase, we may decrease, we may sustain as is, but this will be an assessment we will do as an interagency team. We'll report back to the President, and we'll take further guidance from there.
And, you know, we didn't do it for this reason, but it'll also have an impact on the virus because we have people trying to get in. So not only drugs, but now we have a new phenomena, and that's at least for the next, hopefully, short period of time, the virus. So we'll be able to have an impact on that, too. Please.
Yeah, Mr. President, could you expand on that a little bit? Because you tie it to COVID-19, saying that these drug cartels were taking advantage of the situation, of this pandemic. How exactly?
Well, because we're focused on so many other parts of the country and even parts of the world. And all of a sudden, areas where we had it clamped down pretty tight. In fairness, you know, the wall is up to about 160 miles already. And any areas where we have that wall, it's for the most part contiguous. We have fill-ins, but we're up to 161 miles exactly. And any place where you have that wall, other than walking around it on the edges, it's stopping everybody cold. I mean, we're stopping. Nobody's seen anything like it. That's how good it works. And the other side knew it worked that well, everybody, because everybody was for it 5 years ago. All of a sudden, they changed. It's having a tremendous impact. But we are now focused on so many different things because of what's happened, because of this horrible, I say it's a horrible phenomena, that now we've got to focus on drugs. And the drugs come in from different methods, and we have the best people at sea anywhere in the world. So we'll have a tremendous impact on drugs. But one of the other things will also have an impact, we think, on the virus. Okay? Yeah, please.
Ambassador O'Brien, did China underreport both the number of cases and the death toll from the coronavirus? And if that's the case, Mr. President, what does that mean for our relationship with China and your relationship with President Xi?
Well, number one, I think the President has a great relationship with President Xi, and we'd like to have a great relationship with China. Unfortunately, we're just not in a position to confirm any of the numbers that are coming out of China. There's no way to confirm any of those numbers. There's lots of public reporting on whether the numbers are too low. You've got access to those reports that are coming out of Chinese social media, and and some of the few reporters that are left in China, we just have no way to confirm any of those numbers. Thank you.
We really don't know. How do we know whether they underreported or reported however they report? But we had a great call the other night. We're working together on a lot of different things, including trade. They're buying a lot. They're spending a lot of money. They're giving it to our farmers. They're paying our farmers for the product. So, we're going to continue that along. John, yeah?
I have another one, sir. You tweeted earlier today that there was, you have uncovered intelligence that there was a sneak attack being planned against American troops, American assets in Iraq. Are we talking about Kataib, Hezbollah again? Also,
we don't want
you're
to say,
saying,
but we just have information that they were planning something, and it's very good information. It was led by Iran, not necessarily Iran, but by groups supported by Iran, but that to me is Iran. And we're just saying, don't do it. Don't do it. It'd be a very bad thing for them if they did it.
the last time they did do it in early March at Camp Taji, there was a response from the military against Kataib Hezbollah and Kataib Hezbollah alone. Your
That was a
tweets-
very powerful response, by the way. That response knocked out 5 different places, but it also took out a lot of very bad people.
Your tweets seem to suggest, though, that if it happens again, it may go up the food chain.
Well, that was a very big response. We knocked out a lot. They hit one site, we hit 5 big ones and ammunition sites. You saw that. You saw what happened. And I won't say how many people were killed, but some bad people were killed, and a lot of them. That was a big response. But this response will be bigger if they do something. Yeah, you had one, please.
Yes, thank you, Mr. President. Just going back to your conversation with President Xi, wondering if you received an intelligence report that talked about the discrepancy in the numbers, and if you addressed that with President Xi.
We have not received that, but their numbers seem to be a little bit on the light side, and I'm being nice when I say that, relative to what we witnessed and what was reported. But we discussed that with him, not so much the numbers as what they did and how they're doing. And we're in constant communication with, I would say the biggest communication is myself and President Xi. The relationship's very good. Look, they're spending, they will be spending when things even out. This is obviously a little bit of a hurdle, what's happened over the last month. But they'll be spending $250 billion buying our product, $50 billion to the farmers alone, $200 billion to other things. They never did that before. So we have a great trade deal, and we'd like to keep it. They'd like to keep it, and the relationship is good. As to whether or not their numbers are accurate, I'm not an accountant from China.
Frame things at all in terms of the trade deals?
No, because people just don't know. People don't know where did it come from. I think we all understand where it came from, and President Xi understands that, and we don't have to make a big deal out of it. We didn't like the fact that they said it came from our soldiers, and they haven't pursued that. It was, and that was a mid-level person said that. That was not a high-level person, so I will always assume the best. I'll assume the high-level people didn't know about it. It was a foolish statement. So, look, the relationship with China is a good one, and my relationship with him is, really good. Please.
Can I follow up just on that point on Chinese propaganda that you mentioned, as well as Ambassador O'Brien? So in the past several weeks, China has been shipping PPEs, masks. They've either been selling or donating everywhere, Africa, Europe, Italy, Russia, and really pushing this narrative that they're taking on a global leadership role in the crisis. So what are your thoughts on that, and is there any plan for the administration to take on that role?
I view that as a positive if they're helping other countries. We have 151 countries right now that are under siege by the virus, under siege. Some are doing really badly. They don't know about social distancing. These are countries that aren't highly sophisticated. They don't have great communication to the rest of the world. They don't know the things that we're doing and that some others are able to do. And if China can help them, I'm all for it. I'm for all of us helping everybody. We're soon going to have more ventilators than we need. We're building thousands of ventilators right now. Now, it takes a period of time to build them. And again, nobody could have known a thing like this could happen. We're building thousands. We will fairly soon be at a point where we have far more than we can use, even after we stockpile for some future catastrophe, which we hope doesn't happen. We're going to be distributing them, the extras, around the world. We'll go to Italy, we'll go to France, we'll go to Spain, which is in, very hard hit.
On that note, is there any truth on reporting that your administration is stopping shipment of USAID stockpiles of PPEs abroad?
No truth whatsoever. No.
Your administration
we
is
want.
not...
I would love China and other countries if they have additional supplies, medical supplies, to give to other countries. 150. Why would I stop that? Wouldn't that be terrible to stop it?
Is the U.S. stopping shipment of our own stockpile through USAID to other countries?
No, whatever we have, whatever we've committed to, we commit. But we also need a lot for ourselves, so we're very focused on that until we get over this. So obviously we're not going to be shipping too much until now. We do have excess of certain things, and we don't have enough of others. I just had a great talk today with the Doug McMillan from Walmart, and I gave him a very, very big order for gowns, for protective gear, for the doctors, for the nurses, for everything, and he's actually very excited about it. He's the biggest purchaser of this kind of thing, I mean, of anything probably in the world, and he is very excited about it. And he said, what size? I said, it's almost unlimited. When you look at these hospitals, the amount that they order, you almost say, how could they possibly use so much, whether it's masks or the protective gear? But we are supplying a tremendous amount, and we just ordered a lot from Walmart. And he's taken this on personally. And I said, let it be shipped not to a warehouse, directly to the side of the hospital or wherever they need it, because we save a lot of time when we do that. So Walmart, in addition to many other companies and people, is now involved at the highest level. Please.
The announcements that were made today are aimed at curbing the flow of narcotics into the country. Are you concerned that we're possibly losing ground on the drug crisis while we're...
I don't think we're losing ground, but we don't want to lose ground. That's why we're doing it. I don't want to lose ground. It's a big fight. I've seen many families where they're wiped out because they lost a son or a daughter or a husband or a wife or whatever, or all of them. And we don't want to lose ground. And we are heavily focused on the virus, very heavily focused. And with this, we have never, after this goes into effect, which essentially is now, we will never have been so focused on drugs coming into our country as we are right now. And remember, as that wall gets bigger, that really helps us a lot. Really helps us a lot. Yeah, please.
Is the Mexican government or any other Latin American government working in conjunction with this operation to help with that drug?
Many of the governments are, and Mexico in particular is. And Mexico right now we have 27,000 Mexican soldiers on our southern border, keeping people out of our country. And very few people are coming into our country right now. And as we complete, again, the wall, in addition to the 27,000 soldiers, it's a very tough place to come into. When I took over, people were coming in and they were bringing whatever they wanted. They were bringing drugs of any type, and now it's very hard for them, and it will get harder and harder. But the president of Mexico is a great guy who's really helped us a lot. 27,000 soldiers, 27,000 Mexican soldiers. And you remember when I first took over, they had all of the caravans coming up with 10,000, 15,000 people in the caravans. They were marching through Mexico. That's not happening anymore. Please, in the back.
Mr. President, are narco militants such as the FARC 57th Front out of Colombia or the Maduro regime, do you know if they're working in conjunction with the Mexican cartels? Is there any intelligence indicating that?
I cannot tell you that. I know the answer to that. I believe I do, but I cannot tell you that. We have information that would lead us to believe something very powerfully, but I cannot tell you the answer to that. Yeah, please, Jeff.
Mr. President, have U.S. forces in Iraq taken any precautions because of this particular attack? And have you...
They're taking precautions, and we are watching it very closely. And if something bad happens, it's going to be very painful for the other side.
Have you been in touch with the Iraqi government about this?
They know about it, yeah. They know about it.
Are they offering additional protection or
We'll
anything?
see. We'll see what happens. But, we're down to a small force now over the years. Since we've been bringing smaller and smaller. And we're down right now to a small number, but we have very powerful air power there. We have the big base, and which will, nobody can get near it. And nobody can even get near that. But we've really largely left. We've taken tremendous amounts out, and we've deployed them elsewhere, including bringing some back home.
And do you think tweeting about it will help
I
prevent
think
that from
it's not
happening, or
tweeting,
perhaps
it's called
give them a
social
heads
media.
up?
It's social media. It gets out. I have, hundreds of millions of people. Number one on Facebook. Did you know I was number one on Facebook? And I just found out I'm number one on Facebook. I thought that was very nice, for whatever it means. No, it represents something. And when I can explain to people, just don't do it. It's going to be bad if you do. It's going to be really bad. And they don't need to do it. They have enough problems. Iran has enough problems without doing that. But we've been pulling back very substantially over the last year in Iraq. And so, that's the way it
You
is.
said before you don't want to give the enemy, whoever that is in this case, a heads up. Do you feel like maybe you did?
No, I'm just giving them a warning. It's not a heads up. I'm giving them a warning. There's a big difference. I'm saying if you do anything to hurt our troops, they're gonna pay a price. No, they did last time. As per the question, they did last time. We didn't make a big deal out of it, but we hit very, very hard 5 massive, major ammunition sites, and a lot of people went with it. A lot of bad people, a lot of enemy went with it. And we didn't want to make a big deal out of it, but they paid a big price. They'll pay a much bigger price this time if they do anything.
Now that we have Admiral Gilday here, perhaps we could ask a question about what the plans are for the Roosevelt, sir?
Sure.
In terms of Roosevelt, we're making great progress in terms of testing and also moving people off the ship. So in the past day or so, we've moved over 1,000. That number will increase to more than 2,700 by Friday as we continue to increase the testing as well and fly those samples off. So we're getting after it pretty quickly.
And will the ship remain fully operational?
It is fully operational now.
And will remain so?
It will remain so.
Can I ask a follow-up to that? What protocols are you putting in place to help mitigate the spread of coronavirus among servicemen and women who live and work in those
across the fleet, before we have any ships getting underway for training exercises, for deployments, those sailors are spending 14 days in quarantine before they get underway. We've increased the amount of testing equipment as well as physicians on board our ships at sea. So we've taken additional steps since the beginning of the COVID crisis.
Not too many people are going to be getting off at various ports anymore. Right? I think we probably have decided on that.
You mean civilians?
Thank you. No, military people.
I want to add one. I'd like to add one thing to that. There seems to be this narrative out there that we should just shut down the entire United States military and address the problem that way. That's not feasible. We have a mission. Our mission is to protect the United States of America and our people. And so we live and work in cramped quarters, whether it's an aircraft carrier, a submarine, a tank, a bomber. It's the nature of our business. But the chain of command has very clear guidance, and I'm confident between the commanding officers and the senior non-commissioned officers that they're taking every reasonable precaution to make sure we practice as best we can social distancing, sanitizing environments, etc., consistent with that mission. And that's what I trust Admiral Gilday, Acting Secretary Mobley, and all the other service chiefs and service leaders to do. And I'm confident we'll do that, because keep in mind, we have a job to do, and we will continue to do it, defend the United States of America.
Mr. President, you mentioned the stockpile earlier. The Washington Post reported today that the U.S. stockpile is nearly depleted of PPE. Is that the case, and if so, how are you planning to mitigate
because
that?
we're sending it directly to hospitals. We don't want it to come to the stockpile, because then we have to take it after it arrives and bring it to various states and hospitals. One of the things, and again, we ask the states to do this as much as possible. Many of the states have people that, whether it's that or clothing, they make clothing, lots of clothing in many of the different states. We said, see if you can get it directly from those manufacturers. Make a deal. We'll use the Purchase Act if we have to on them. If they won't, by the way, so many people are, the spirit is incredible what they're doing. But we've asked states where they have large manufacturers of different types of equipment to use those local factories, those local plants, and have it made directly, ship it right into the hospitals. We're shipping things right in. We have, as you know, almost 10,000 ventilators, which we need for flexibility. It's a lot. It sounds like a lot, but it's not, because as you see on the board from yesterday, as this scourge, as this plague, as this virus moves, it moves very fast. And we don't know yet whether we're going to need it in Louisiana, in New York, wherever it may be. So we're ready for it. We're totally ready for it. We're going to be shipping out. We've already agreed to ship out over 1,000 today to different sites, different locations. but we have to have the flexibility of moving the ventilators to where the virus is going. And we'll be able to see that, we'll be able to see that from charts a couple of days in advance. So right now we have a nice pile of ventilators. We have a lot more coming in. We have I think we have 11 companies making ventilators right now. Very good companies, and they're making them. You know about Ford, you know about General Motors, but we have a lot of companies making the ventilators right now. So now the question is, when you make one, it doesn't get made in 15 minutes. It's not, a mask can go quickly. A ventilator takes time to build. It's very, very, as we discussed, it's complex, it's big, it's expensive, et cetera. But we'll be able to move. We have great flexibility, John.
I was just going to say, sir, do you want to move on to solely coronavirus or stick with
I think if does anybody have any other questions for this great group of brilliant people? Yes, please.
Thank you, Mr. President. Question for Secretary Esper. Is the military personnel that's been fanned out across the country to help combat the virus, is there any chance that they're planning to see at some point have those military personnel treat or see COVID-19 patients?
Well, excuse me, as you know, we have the hospital ships currently deployed, one in LA and one in New York City. So they could be treating patients as they come in. We're taking precautionary measures to screen them beforehand to make sure that they're not exposed, if you will. Same with the military hospitals that we are deploying, certainly again to New York, Seattle, and other places. But the one thing we got to be careful of is that these are deployable assets. They are unique. So if we want to retain the ability to deploy military doctors, expeditionary military hospitals around the country, we got to preserve and protect them as best we can. That said, we remain completely available to assist as need be, as directed by FEMA, as the Vice President and the President asks us. That's what we commit to do to the American people to help safeguard them and protect them through this virus.
So as part of that, will they be seeing coronavirus patients, or will they strictly be seeing other patients and helping them?
They could have called upon. I think the best use for them is based on their training and how they're structured and organized is for trauma. We can take the load off of hospitals with regard to their trauma patients, thereby freeing up rooms, and other doctors, particularly doctors who are, respiratory nurses or doctors who deal with infectious disease, to treat those type of patients. So I think it's the best use of our resources. But again, if push comes to shove, we're prepared to do what we have to assist the American people. At the same time, preserving the medical capability we need to support our operation deployed forces abroad.
And we're looking at doing 2 additional brand new hospital ships, because these ships have really, they've really struck a blow, very positive blow for what they're doing, going to Los Angeles, going into New York. So we're looking very seriously at building 2 additional ships of about the same size.
Building 2 new ones or deploying 2?
It'll either be, building, but we're looking at building either 2 new ones or doing the renovation of another large ship. But this has really worked out well, so probably 2 brand new ones.
So Mr. President,
Is this concerning the gentleman, or do you want them? You don't want them to get back to work and capture all those bad people?
A follow-up, Mr. President, or Mr.
Sure,
Secretary. I know that Secretary Wilkie has said he's on standby waiting to hear if VA hospitals need to be opened, the doors need to be opened to civilians.
True.
Are you talking about that?
Yes,
could we see that happen? How soon could that happen?
Yeah, certain can move very quickly. He's a very capable man. We're ready to move very quickly. As an example, in Louisiana, they have a very big hospital, so we're looking to move very quickly if we need them. Hopefully we won't need them. We're going to find out pretty soon. We're only going to know when, at the time it happens. We prepare for the worst. We are preparing for the worst. Unfortunately, that's the way we have to look at it.
Just to follow up on the purpose of these naval ships, you mentioned something about treating trauma patients, and I'm just curious. What about things like giving birth? Would mothers be expected in New York, for example?
Well, as I understand, they're not doing that on the ship. That's the one thing they're not doing outside of the COVID-19. They're not doing that. The birth of a baby not being done on the ships.
Okay. Can I have a follow-up question with Attorney General Barr, please? This has to do with the visa restrictions on immigrant doctors. Is the administration considering easing the restrictions or waiving restrictions for doctors with J1 or H1B visas so they can help other doctors during this crisis?
Actually, the immigration laws are no longer under the administration of the Department of Justice, and I haven't been participating in any of those discussions.
What about you, Mr. President? Can you respond to that
One
question,
more for
Mr.
this group
President?
back here, please.
To Secretary Esper, the WHO, this is on the topic of coronavirus in Iran. The WHO confirms that Iran is vastly underreporting its coronavirus cases, not just cases, but fatalities. According to on-the-ground estimates, that might be as high as 15,500 deaths. 32 commanders in the military in Iran are now confirmed either in dire condition or dead. You have 8% of the parliament now down with coronavirus. So is Iran's soundings of aggressions today that President Trump just tweeted about, do you think strategically, is that a bluff on their part, or is this a sign of very clear desperation? Where are you strategically on that?
Well, first and foremost, we empathize for the Iranian people. I mean, they clearly have been hit hard. As you know, I think the President's spoken about it, certainly Secretary Pompeo. We've offered assistance, we've offered medical supplies, etc. They have refused that. I think if the Iranian regime put more interest in terms of taking care of their people, in the context of this virus, they would be better served. Instead, the Iranian regime continues to want to spread its malign activities throughout the region. They want to continue to send out the Quds Force and others to cause problems throughout the region. We know that in one way, shape, or form, they're either resourcing, directing, approving, or whatever, operations for Shia militia groups in Iraq that are targeting American forces. So I think at the end of the day, again, I feel deep concern for the Iranian people. The important thing is that the Iranian government should focus on them and stop this malign behavior that they've been conducting now for over 40 years. I think the entire region, and certainly the Iranian people, would be better off for it.
And I happen to think they want to make a deal. They just don't know really how to start. And they've been given some bad advice by former Secretary Kerry, some very bad advice. And I really think they want to make a deal, which is the Logan Act, but would have to look at the Logan Act. All you have to do is take a look. I think they've been given very bad advice by Secretary Kerry. I think that they're dying to make a deal. Look, their country's in trouble. Their economics are shot. They've got a lot of bad things going. I think they'd like to make a deal. They can get it settled very quickly. No nuclear weapons. No nuclear weapons. They can't have nuclear weapons. It's very simple. Okay, let's let these folks get back to work. Is that okay? Thank you all very much. So as we deploy our service members to combat both threats abroad, invisible enemy at home, earlier today I spoke to our nation's incredible warriors and military families. Spent a long time on the phone with thousands and thousands of families that were hooked in. In order to stop the spread of the virus, some of these families have delayed planned moves to their next duty station.